health agencies scrub HIV, other data to remove gender ideology. Trump has ordered federal government to solely recognize male and female sex. The U.S. Centers for Disease Control and Prevention and other federal health agencies on Friday took down webpages with information on HIV statistics and other data to comply with Trump administration orders on gender identity and diversity, raising concerns among physicians and patient advocates. CDC webpages that appear to have been removed include statistics on HIV among transgender people and data on health disparities among gay, lesbian, bisexual, and transgender youth. A database tracking behaviors that increase health risks for youth was offline. Earlier this month, President Donald Trump ordered the federal government to solely recognize male and female sex and eliminate diversity, equity, and inclusion programs. The Office of Personnel Management gave agencies more specific guidance on how to comply with the orders in a January 29 memo, saying they were to be completed by 5 p.m. Eastern Time, 22 o'clock GMT. On January 31, it specified that agencies must end all programs that promote or reflect gender ideology extremism by recognizing a self-determined gender identity rather than biological sex. The measures include removing references to gender identity online. A spokesperson for the Health and Human Services Department, which oversees the CDC, said any changes to websites follow this guidance. There's a lot of work going on at the agency to comply, said a source who was not authorized to speak publicly, adding that the CDC is taking down anything on the website that doesn't support this executive order. Deletions from the CDC's site include pages with data on HIV in the United States in general, as well as pages with statistics on HIV in Hispanic/Latino people, women, by age, and by race and ethnicity. The elimination of such data creates a dangerous gap in scientific information and data to monitor and respond to disease outbreaks, the Infectious Diseases Society of America and the HIV Medicine Association said in a joint statement. For example, a page with information about how people can get HIV tests was offline on Friday, according to the Internet Archive, as was a page for doctors with information about testing for HIV and treating patients. This is very alarming, said John Peller, head of the AIDS Foundation Chicago. In many cases, basic health information is going dark. Timothy Jackson, Senior Director of Policy and Advocacy at the group, said they are going through the CDC website and printing out information used to educate people about HIV that may not be accessible after Friday. Also missing from the CDC's website was the Youth Risk Behavior Surveillance System, which tracks trends in tobacco use, teen pregnancy, unsafe sexual behavior and other aspects of teen health. At the National Institutes of Health, a senior employee this week urged agency leaders to refuse to implement the Trump administration's guidance in an email to acting NIH Director Matthew Memoli and other top officials that was seen by Reuters. The employee, Nate Brott, director of the NIH Executive Office, said Trump's orders ran contrary to years of NIH research and findings about sexuality and gender. By complying with these orders, we will be denigrating the contributions made to the NIH mission by trans and intersex members of our staff, and the contributions of trans and intersex citizens to our society, he wrote. These policies will lead to mental health crises or worse for tens of thousands of Americans who contribute productively to our communities.